Now coming to the dosage of the aspirin, we have already discussed that the low doses aspirin or baby aspirin, which is from 50 to 325 milligram, can be used as an antiplatelet because it inhibits the thromboxane A2 production. The second one is the intermediate doses, which is used for the analgesic effect, and it is 2 to 3 grams. And in higher doses like the 4 to 6 gram, the effects are mainly the anti-inflammatory. Now coming towards the adverse effects of the NSAIDs and aspirin. So first, they can cause nausea and vomiting in the GI tract by the irritating effect or the activation of the chemoreceptor trigger zone. As discussed earlier, they are also ulcerogenic because they can decrease the production of the prostaglandins, which will increase the secretion of the HCl. They can also cause hemorrhagic gastritis. And note that NSAIDs are most important cause of the hemorrhagic gastritis, mainly aspirin. The next one is the hypersensitivity, and this the bronchospasm is very important, so these drugs are contraindicated in the asthmatic patient. And why it happens? So as we know that the arachidonic acid can go into COX pathway or the lipoxygenase pathway. The lipoxygenase produces leukotrienes, which can cause the bronchoconstriction and worsens the asthma. So when aspirin acts on the COX and inhibits it, so this pathway is more stimulated and increase the production of more leukotrienes, which will cause more bronchoconstriction. That's why these drugs are contraindicated in the asthmatic patients. Moreover, they can cause urticaria, skin rash, rhinitis, and angioneurotic edema. The next one is bleeding. We should know that the aspirin has interference with the metabolism of the vitamin K in the liver. It interferes with the functions of the vitamin K. That's why the vitamin K function is decreased and the production of the clotting factors are also decreased, which will finally leads to bleeding. The next one is very important one and related to aspirin. Aspirin and the children which have viral infection can lead to the Reye syndrome. I will explain this. Reye syndrome basically has two major pathologies like the hepatic dysfunctions and encephalopathy. Encephalopathy means the pathological states of the brain. So it occurs in the children with the viral infection. So how it occurs, we will go to the pathophysiology. We know from the previous lectures that salicylates basically damages the mitochondria and uncoupling of the oxidative phosphorylation. When this occurs due to the decreased ATP production and increase in the ammonia production, there will be damage to the liver, which is hepatic dysfunction, and brain, which means encephalopathy. Now, why it occurs in the children with viral infection? So, with viral infection, we have increased level of the interleukins and cytokines. These interleukins and cytokine potentiates the damage to the mitochondria, which will potentiate the effect of the aspirin on the damage of mitochondria and will lead to the Reye syndrome. Moreover, they are contraindicated in pregnancy because they can delay the labor. We know that some of the prostaglandins are involved in the induction of the labor, so when these are inhibited, then there is delayed labor. There is analgesic nephropathy, means when these NSAIDs are used for really long time, they can lead to the nephropathy. And why it happens? So because on the efferent arterioles we have receptors for the prostaglandins, and which regulates the blood flow to the glomerulus and also regulate the GFR. So by inhibiting these things, we are inhibiting the GFR regulation. So it will lead to the nephropathy.